Now I'll go back again to Jenny, who is going to give a little bit more in-depth information about an innovative method that we included in the guidance document that helps linking and triangulating different data sources, the 6-box method. Jenny, if you can do that as well now, and after that we will do a few minutes on further questions and answers.
Thank you, Lally. As before, I'm just sharing my screen, 2 seconds. Can you see the slides? They're correct. Yep, brilliant, perfect. Thank you, Lally. I will try to do this briefly, mindful of time. So as Lally says, one of the things which is new in this guidance document is we really want to support countries in going through on a step-by-step basis. How do you go about quantifying missed or misclassified deaths in your civil registration or other data collection system? All data collection systems are vulnerable to incomplete and misclassified data. And whilst obviously plan A, the ideal is always to reduce these numbers as much as possible so that these women appear in the data. We recognize that that is not always possible. And the next best thing is to collect accurate information on how many deaths are being missed so as to improve our systems so that future years the data can be stronger, and also allow this information it to be important and used in its own right to adjust any years for which it's not possible to compare data sources, and so strengthen that data as well. We're calling this the 6-box method because, as you'll see in a minute, there are 6 different categories which a number needs to go into, and then these numbers can be used to calculate metrics such as sensitivity and specificity. I won't talk about that during this webinar, but how to do that is also outlined in the guidance document. The other thing to mention is that even partial information is useful. So even if you can't complete all 6 boxes, even if you can just complete 4 of them, for example, that is still a really valid and useful exercise. So don't let perfection be the enemy of the good, because getting some information is better than getting none. So here I'm going to present the concept. Imagine that the rectangle that you can see on the screen represents all deaths that occur in a country. It's not intended to be to scale. So the size of the boxes are not important. It's just to illustrate and demonstrate the concepts. So this rectangle is all of the true maternal deaths, all of the true deaths which take place in a country. And these are the deaths that you would know about if you were some omnipotent superpower, if you had magical powers, if you truly knew everything about the world. In reality, we will only see a subset of these deaths in our data collection system because some of them will be missed and not recorded. Of this universe of the true maternal deaths which could take place, some of them will in reality be true maternal deaths, and those are illustrated in green on the slide. And some of them will be true non-maternal deaths. Those are the 2 possibilities. The first 2 boxes. So of this pool of all the true deaths which occur that only our omnipotent superpower knows about, some of them are going to be registered or captured in our data collection system, and some of them will not be. Unregistered deaths are those that don't appear in our data at all. They're completely missed. This may be because they were never recorded in the first place, or it may be because they were recorded, but for one reason or another, they were lost during the data processing. For example, if the deaths were recorded on paper and during the transfer to electronic format, mistakes were made. So there are different reasons why this could occur, but the outcome is the same. Of the unregistered deaths, they are shown in the right. We're using the letter U to represent them, and some of them will be true maternal deaths, and some of them will be true non-maternal death, or U+ and U negative. So those are your first 2 boxes, the deaths which were never captured in your data collection system. Next, we look at the deaths which are recorded in our data collection system. Similarly, Some of them were originally recorded as maternal deaths, and these are shown on the left. Of these, some are true positives. And what this means is that the original classification of the cause of death was correct. They were recorded as a maternal death, and they really are a maternal death. However, some will be false positives. They were originally recorded as a maternal death. However, in reality, they were not a maternal death. They were a death due to some other cause. These might be identified during review of the deaths by expert committees. For example, if all the available information that is available on these deaths is gone through and it's realized that earlier an error was made in the misclassification. And those processes are some of the things my colleagues have just been talking about. This brings us to our final two boxes. These are deaths which were not included, which were included in the data collection system, but were not recorded as maternal originally. Of these, some of them were correctly classified, and these are the true negatives. This means in reality, the woman was recorded of not dying of a maternal cause, and that's correct. She truly didn't die of a maternal cause. However, some of them will be false negatives. And this means that the woman in reality died from a maternal cause, but was assigned to another cause of death, a non-maternal cause of death. And there are many reasons why this can happen. Some of them, for example, it may be that her pregnancy status is not known about. It may be that she died of a late maternal death cause or an indirect cause, and the relevant information about her pregnancy was either not known or not recorded. Or it may be, for example, linked to pregnancy with an abortive outcome in certain settings, and that information was not recorded. Ideally, we want all of our deaths to fall into two of these boxes, into the true positives and the true negatives. But in practice, we know that that is very often not the case. This final slide gives some examples of potential reasons why a death might fall into each of these boxes. It is only intended as illustrative because there are obviously a very, very large, probably infinite number of reasons why this may occur. But an example of a true positive death is a death due to postpartum hemorrhage that was correctly recorded as such. An example of a false negative death is an indirect maternal death due to pre-existing diabetes where pregnancy status was not recorded and was lost from the data collecting system. An example of a reason a death might fall in the U positive box is an abortion-related death which is taking place in the community and was never recorded. An example of a false positive death could be, for example, a death from a car accident where the woman was pregnant and she died, which was incorrectly recorded as maternal because it is a pregnancy-related death, but it is not a maternal death as the cause is not related to the pregnancy. And conversely, a true negative death would be if this same woman had had her death correctly recorded as a non-maternal death in the first place. And finally, the U negative box, that could be a death due to an accident that was undocumented and not recorded in the data collection system. As I say, there are infinite examples and reasons why a death may fall into any of these boxes, but the important thing is to count them as well as possible. So to conclude, the 6-box method is intended to set out in simple steps numerical information that it is useful to report in addition to the final correct total on the number of maternal deaths. And these numbers can then be used to calculate sensitivity and specificity, which is outlined in the guidance document. It's useful to report this information because it can be applied to adjust for time periods in the country where it's not possible to quantify missed or misclassified death. And it can also be used to correct the data for other similar settings. And the guidance document provides a case study from a team in Zimbabwe who applied this method in their own setting, which is obviously challenging as a high burden mortality setting with many deaths taking place outside of health facilities. But it was a really great example of how this method can be used in practice to strengthen data. To conclude, overall, enhancing the accuracy of our data and transparently recording other information about the methods used to collect it means that we can measure maternal mortality more accurately. Accurate data, in turn, allows for careful monitoring, for improved policy and programming, and ultimately will help us avert more maternal deaths. I'd like to stop there. I see we only have a very, very short time remaining, but thank you for your attention, and I will pass back to Lale to chair the final remarks and any time we may have for questions. Thank you.